Do you find that this is a city where people are active in treating and participating in the mental health system, or do you find that people typically come to you after they're really, really like in a lot of the health disparities research, one of the things we see is that certain groups of people really seek out physical care in the emergency room. Do you find in mental health and behavioral health that's the same issue?
I think that it is pretty similar. As working in the public sector, I work with the people sometimes disenfranchised, they are poor, they have a lack of resources, or they have a severe mental illness. So issues that I find in my practice, stigma is still quite prevalent in New York. And believe it or not, lack of insurance or lack of access or lack of money to pay for the treatment is also an obstacle that I see for people to seek treatment. Those are quite significant. In some particular populations, I would say minorities like Latinos, even African Americans and perhaps Asians, there is this concern that you don't share your problems. You keep everything in the family, so that prevents people from seeking help or going to a professional or going to the mental health clinic, or even just opening up to a practitioner, nurse, social worker, anyone that they see for any other reason, and talking about the problem. So that could be another obstacle for people to seek treatment.
That's an excellent point that you're making, because as you talk about that, I'm thinking a lot about some of the conversations I've heard in behavioral health about culturally relevant interventions, treatment, and even systems. Systems that recognize that people exist within a setting, a family setting, a work setting, a community setting, and providing treatment that sort of recognizes that and is appropriate to that, is helpful. What has been your experience with that?
In my experience with HAC, for instance, in the past, something that HAC was doing, I mean, the particular hospital that I was working for, it was reaching out to the curanderos, for instance, because this particular hospital, Elmore's, is located in a very Latino community. So we found out that the patients, before seeking professional help, they were going to the curanderos.
Now, could you educate our audience about what the curanderos is?
Curandero is like a healer in the for the Hispanic communities. So that was the first point of entrance. So we said, okay, so let's educate the curanderos, these healers, for them to try to distinguish when they need to make a referral, because they are well positioned in the community. Their members of the community look up to them. So, and they are going, it's very likely that they are going to follow their advice. So if they recommend, okay, this person needs more than just a magic touch or something like that, he or she really needs to see a doctor, it's very likely that the person is going to follow their advice and come to see the doctor or the psychiatrist at the hospital. So that's a way of being within the frame of being culturally sensitive. So get the word out, educate, and try to for the people to get help on time.
I like that example that you gave, because in my own work, I definitely believe that aligning with the client, the patient's cultural beliefs, behavioral beliefs, is a way of helping them to accept, deal with, or participate in treatment. Are there any times, though, when you would say maybe aligning with their beliefs might not be efficacious or helpful to getting them the appropriate care or treatment or participating in it?
For instance, medication. That's a big topic. There are people that have many misbeliefs or myths about medication. They think that medication is a crutch, or that they are going to become addicted to medication, or that medication is just for weak people, or medication just doesn't go along with the culture. So if the person has a condition that really needs medication, because it is true that not every psychiatric condition needs a medication. Yeah, there are conditions that could be treated with therapy or other kinds of interventions. But if it's something that needs medication, I mean, I can't align with that belief. I need to educate the person, explain to them and their support system that this is important and that that's the foundation of the treatment. And then over that foundation, you build other types of treatments.
Yeah, yeah. You know, I'm glad you raised that topic, because that's something that in my work, and certainly in your work, that comes up quite a bit. Like, when should I take medication? Will I have to take medication the rest of my life? Should I totally just do therapy to deal with this particular issue? How do you deal with that? And in fact, what's your approach in terms of medication?
Like I said, mental illness is just like any other medical conditions. For instance, when a patient has diabetes or high blood pressure, if the diabetes or the high blood pressure is not severe, the first time that you go to the doctor, they say, unfortunately, Mr. Such and Such, you have diabetes. So you need to modify your diet and modify your lifestyle, do more exercise, do certain things. But usually the doctor, at least that the blood sugar is skyrocket high, is not going to give you medication or put you into the hospital. The same with blood pressure. Blood pressure, if your blood pressure is not too high, initially the first stop is, okay, you need to decrease salt intake and try to lose weight, do other things. And then if that doesn't work, or the blood pressure is really, really high, that's when you need medication. Mental illness is not different from that. So there are conditions that, for instance, let's take depression. If the depression is mild depression, even some moderate depressions, they can be managed with psychotherapy. There are different kinds of psychotherapy, changes in lifestyle. Yeah. So those are the things that they are going to help, and the person is going to get better and be able to get on with their lives. However, if the depression is severe, the person is having, and a depression is severe when they are having suicidal thoughts, or they break up with reality, believing things that are not real or seeing things that are not there, that's a severe depression. So in this case, the person must take medication. The foundation of that severity of the illness is going to be medication. Obviously, the person needs therapy and other changes in lifestyle, but just changes on lifestyle of psychotherapy are not going to help, because the person is not in a state of mind when they can process and do all the hard work that psychotherapy needs.
Yeah, yeah. It seems like our work as in behavioral health, a big part of it is dealing with the stigma attached to mental illness. Now, do you see any changes in terms of how people who come to you, how they approach their mental health? Do you think that part of our struggle with, how people feel about being diagnosed as crazy, do you see any changes happening in that?
I think that especially in depression and anxiety, it has been some change. First of all, because there is more education, and because there are celebrities that are coming out and saying, okay, I was hospitalized for bipolar disorder, or I have been struggling with depression. So that people say, okay, so I guess it's not a death sentence, or it's not so terrible. However, in schizophrenia, still the stigma is there. It's a very severe illness, although there is hope, there is treatment, there is recovery, but unfortunately there is no Hollywood star endorsing the illness and making it glamorous. So we still have a lot of problems with schizophrenia.
You know, it's funny that you say that, because I think a lot of us will say that the role of media and TV has really, in some ways, positively impacted, especially I think with younger generations.
Yeah.
At the same time, I do think within certain cultural groups and pockets, there's still problems with talking about your mental, or even admitting your mental illness. Would you say in your work that's been, you've had a similar observation?
Yeah, it is very similar, and I work with Latino populations,
Yeah.
and I find that it's still, because there is this generational gap.
Yeah.
So sometimes the younger generations, yeah, for them it's kind of cool. Yes, and going to see a therapist is not a big deal. For mom and dad, is wow, this is like a shame. It's something to be embarrassed about.
Yeah. And that certainly can impact the way in which they participate in treatment.
Absolutely,
Yeah.
it does. Yeah, because when there is the identified patient, but illness usually affects the whole family.
Certainly, certainly. And as we talk about stigma and how